is a story actually that I had for you over the summer. I don't know if you remember, for those of you who are new, in Genesee County, there was a school district that had a grant and they were going to start putting medical clinics actually in schools. It was in Mount Morris, I believe it was. And there wasn't much discussion within the district. It just happened. So there's actually medical clinics in schools, and some of the rules surrounding them were a little uneasy for parents because there were some, I don't even want to say procedures, but there were some things that the school or the medical facility did not have to tell parents about. And that got to be a little concerning. And we're dealing with that now, the possibility of that in Metro Detroit, in Northville. And like I said, I have a lot of family in that area. Matt Wilk joins us now. I think you follow me on Facebook, and I you didn't message me about this. I stumbled on this in a forum or something. So good to see you, by the way.
Thank you. Thanks for having me.
Yeah, and this is it's just to learn more about what this is, and it's very interesting. So when did you first know the school district? Did they put out a letter or a Facebook post? How did you know this was even a thing?
No, actually, I used to sit on the school board, so I'm friends on Facebook with a bunch of the school board members, and one of them reached out to me and put a post out saying, "Hey, we'd like your input." It didn't come through the standard channels. I mean, I don't want to cast aspersions, but it was pretty obvious they didn't want really too much in the way of input or discussion. But this one particular board member who does not agree with me politically on virtually anything put this out there and tried to call attention to it. I think at least to have the discussion, at least to have parents understand what was going on. I think me personally, I think as a parent, I think when they find out, they're not going to be really that pleased.
Someone just wrote in the comments, so we're dealing with this in Traverse City too. So that is the thing. If you're a parent out there, you might as well just ask your district, because this is a statewide program that is available. It's a grant.
It's a grant. They are being asked to apply for a grant to put a health clinic in their own school. The grant covers the medical care. It does not cover the cost of the building. We'll talk about that, I'm sure. It doesn't cover things like that. It has been rejected in 2 local school districts recently. Grosse Pointe was well along the way.
Really?
They got it. Yes, it came to the attention of parents. They elected to go to the ballot box and make changes, and they turned it down before ground could be broken. The cost was roughly $1 million, a little bit less than $1 million, because once you build a medical office, there's certain things you have to do. You have to agree as a district to keep it up to medical standards, and they like you to build an exterior entrance, because this is supposed to be a community clinic, not just a school clinic.
So community meaning not just students. I mean, could you have the average Joe just walking in?
I think it's tailored for kids, but I think an average in our case, Northville student, could they walk in and use the clinic? I think if it's like Grosse Pointe, I had a long conversation with the school board member, Grosse Pointe. That is exactly what they were worried about. Is that why do we need a clinic when we have clinics elsewhere, right?
Yeah.
That didn't make a lot of sense.
I'm reading the note here, some of the key points. Michigan Medicine, that's who would be behind this one, Michigan Medicine.
Right. So this is a Michigan Medicine one. Theirs, I think, was a Corewell, and I'm sure, up in Traverse City, it's a different one as well. These are all, I believe this is either federal money trickling down to the state or state money that they want to give away money to provide additional health care. One of the important questions that a parent asked, a parent who happens to be a pediatrician, said, "Hey, is this money I get giving a new health clinic in a low income, underserved area?" That I understand that entirely. Northville's not either of those. So
no.
Why are they going to Traverse City? Why are they going to Grosse Pointe? Why are they going to Northville when that's the target of the goal? Oxford was another one that turned it down with their issues. And understand, that is a serious, long, deep, painful discussion they're having about how they run things. They turned it down too. And I think that the genesis was in and around that lack of information piece, because if you read the report, the 500-page report, which I did, that's a big.
Yeah. This says the center will offer a range of healthcare services, including preventative care, immunizations, basic medical exams, sports physicals, and treatment for minor illnesses and injuries. This is not meant to replace a primary care provider. Additionally, the SBHC will provide behavioral health services, counseling, and support for emotional well-being. Okay, well, do parents have to be notified about all of that?
No,
Okay.
no. The answer to that
And let
question is
me,
no.
yeah,
Yeah.
let me put up on the screen what I think I took from that. This was from their factoid they put out. It says under Michigan law, minors can only provide consent for limited mental health and sexual, not for so basically they could give limited mental health and sexual health. What is that? I mean, what does that consist of? Do we even know?
Well, no, I mean it's relatively broad, but use your. I mean the matters that were discussed at the board member: pregnancy test, an STD test, birth control. Um, it's a large number. It's like 12 mental health visits. Again, without not only parental consent, that's one thing, without parental knowledge. So if I, as a parent, my daughter is acting weird, and I call the school and I say, has my daughter availed herself of these mental health services? Because I'd like to get some for her too. They will tell me, we will not tell you. You do not have the right as a parent under this plan to know. I mean, that for me is it just, I mean,
Well,
I don't need to go much further than that as a parent. I happen to be a parent of two 16-year-olds, and
and
that's
that, and that is
ridiculous.
Michigan law. That is Michigan law. I think under that they do not have to
Correct. Now,
tell you
here's the
that.
that's Michigan law for now. If the governor, in her infinite wisdom, and the Michigan Democratic Party, who have been ramming things through, says, nope, we're changing the law and we're going to allow, say, immunizations without your consent. These guys came on, these two Michigan health guys, and they said, well, we don't do any immunizations at this location. And then later on, they were asked, what kind of drugs do you carry at this? Is there controlled substances? Should be worried. And they said, no, not controlled substances, just like random stuff and immunizations and stuff like that. Which was it? Either are they not doing it, or are they doing it?
It,
And the fact that this ball moves, and you'll never know. You'll
let me
never know.
let me see if I can bring this up here. I'm having computer issues, but let me make this bigger. This is where's this from? This is from
The
the
Adolescent Health Initiative. This
yeah.
is from the University of Michigan.
Let me try to
Their
make it
handbook.
bigger. Let me try to
Yeah,
make it
thank you.
bigger here. Okay, I think we can see it. This is okay. So this is kind of what I've seen before. And for people watching, so this is the law or the rules when it comes to the minor and consent. A parent or legal guardian must provide consent on behalf of a minor under 18 for before healthcare services, with several exceptions. Emergency care. Oh, care for emancipated minors. So
Right.
that means basically you're no longer legally with your mom or dad, right? Or
Correct. That's a legal proceeding to become
yeah,
emancipated. Correct.
yeah. And then specific healthcare services related to sexual health, mental health, substance abuse treatment. So for those three things, the parents do not have to know, right?
Yes, correct. Do not have to know, do not have to be asked in advance, and it will be confidential. You will not have the right to know if your child has received one of these services in this school clinic.
Which are under sexual health, mental health, or substance abuse treatment. And that's kind of broad.
It seems very broad to me. I think I'd like to know if my child has asked for something involving substance abuse, sexual health, mental health. I'd like to know.
Now, the
It's
purpose, I'm going to try to give some goodwill. The legislation or the lawmakers, were they thinking possibly, and I've heard people argue with this me before, well, what if a child is kicked out of his home and he's homeless? Or what if he's being abused at home? Or what if he's living with parents who are drug dealers? I mean, that could be a concern, but there's other routes that they could
correct.
go as well, right? I'm
Well,
just
first of all, those same rules exist, I admit, in other clinics. So the question
yeah.
is is it better to have the parents attempt to be engaged? If a child walks into a health clinic and says, hey, look, my dad hit me, first of all, we talked about that. That's a reporting. They're filling out a form, they're calling the police, Child Protective Services is calling back. That is a thing, and it's good. They should be, okay, in those
Yeah.
sorts of circumstances. So what we're talking about here is something much broader. And why did we pick these? Okay, is there something special about these that leads us to conclude why the state picked those, right, versus something else? And the answer is because they don't like how parents handle that. They think they
Which
know better, right? Think
yeah, it's
about it.
none of their damn business, honestly.
None of their damn business.
So moving on, patients under 18 have the right to the following without parental guidance, consent, or knowledge. Okay. Oh wow.
Yeah.
Did I read this right? Pregnancy testing and prenatal care. So this is parents. So if I have a young girl, but she's not that age, but let's say she's 15 and she could go have a pregnancy test without me knowing.
She could have asked for birth control pills without you knowing.
Okay, birth control information, contraceptive testing and treatment for sexually transmitted substance abuse treatment. Yeah, that's and I need to know. Yeah, that's as a parent, I would want to know those things.
Right. And I get it. I get that there are circumstances where the parents are recalcitrant. I get that. But there are methods to handle that through existing channels. What we don't do is throw the baby out with the bathwater and say, because there are some parents that don't handle things at all appropriately, therefore all parents will no longer have the right. Except understand there's an adult, someone from the medical clinic, there's probably an adult counselor, there's adult administration. Those people all get to know and understand and see, but not the parent. So
yeah, which
yeah,
is concerning because this one, patients ages 14 and up can access mental health counseling without parental guardian consent or knowledge. Finding I know a therapist or mental health counselor, they're not all the same. There are some bad ones out there. Mostly they're good, but I think as a parent, it's a decision for the parent and the child to be part of one, to be part of their care, because I don't know what is this person's background, this counselor, what I don't know where they're coming from. I mean, it's to me it's dangerous.
you don't know what they're being told, you don't know what they're discussing. You haven't provided any background information, right? I mean, if you go through this, you go in, you meet, you say, hey, this is the background, this is the circumstance. If you have a traumatic incident, you say, hey, this traumatic incident occurred. I'd like you to help my child talk their way through this with somebody who's not a parent. Understandable. Again, 100%. But
Yeah,
because right, because there are some some parents that don't do it the way the state or the district or this health clinic think is the right way, that doesn't mean they cut all the parents out and say, sorry, parents, you don't get to decide anymore.
yeah, and yeah, minors need a parent's permission for vaccines, mental health medications, inpatient mental health treatment, or an abortion, and that's as of right now.
As of right now, correct.
I would hope, as a journalist, I don't give my opinion as a journalist, but as a dad, I would hope to God that would never change, because if they're under 18 and they're my child, I should be involved in that.
Right, 100%.
So not saying it's going to change, but that's where it is.
It's where the law is today, and that law has changed over time, and as the pendulum changed very, very quickly, as we've seen in the state over and over again. So relying
Yeah.
on law doesn't allow it now, because here's what happens: the law changes, the clinic's already there. So you're going to remove the clinic because the law has changed? No, you're not. No, you're not. You keep the clinic going.
Yeah, I can see something like maybe a sports physical, but still, as a parent, I'd still want to sign off on it. That something as simple as that. I want to be involved. I have a 6 and a 10-year-old, and I want to know anytime there's a doctor or someone. Heck, even if the principal's talking to my kid one-on-one, I at least want to know about it.
Well, that's one of the arguments that we discussed. Currently, for a 13-year-old, you need to sign off on their schedule. You need to sign a permission slip for them to get on a bus and go to Lansing. You need to go to their parent-teacher conferences. You're allowed to know everything that's going on with the kid. But magically, with these categories, you don't need to know? No, No, that it was kind of laughable because I've been on the school. I had been on the school board for 8 years, and I know most of the administration. They haven't turned over too much. And the guy from Michigan Medicine said, "Well, we make an assessment of whether this is a mature minor." And I said, "Mature minor." I've sat through the presentations where they say these are the number of disciplinary referrals we had at the middle school, and it's a big number, right? And that happens. It's totally normal. But
Well,
are they mature enough? They're not mature enough to
no.
drive. They're not mature
And-
enough to vote, but they're mature enough to get a prescription for contraceptives. Okay,
I hate to say this, and being a journalist, but after reading what just happened at Oxford, and the independent report says Oxford was partially responsible for the shooting. Now, school districts, in my 25 years of being a journalist, they are often not forthcoming with information, and it's very sad. And maybe another reason why people are leaving public schools. But someone just said in the comments, if this was going to be a community clinic, how is school security going to be addressed? Yeah, I don't know. Are regular people going to be allowed to come and go, or is it just the school?
I don't know in this one because they haven't. My particular district, they have not addressed the cost. They have not addressed all those issues. Grosse Pointe, it started out as a $750,000 thing, went up to about $950,000. It was a big deal. There's all kinds of issues associated with. The biggest one is this. Is this, in my mind, is this an underserved community, right? Because if we're getting a grant, we're taking from somebody else. Okay. And what I said at my board meeting, I live in Northville at the corner of 7 and Haggerty. Okay. Big location. On the northeast corner, there is a Beaumont hospital with walk-in emergency care. On the southeast corner, same thing, Trinity. On the southwest corner, same thing, U of M. And we need to walk around. We're going to make a map of every single doctor's office and health clinic and say, this is already here. I get it if it's an underserved area. I have a suspicion without knowing the reason why they like to go in these non-underserved areas is because we have private insurance. I used to have a relative in the healthcare industry, and they would lament all the time about how low Medicaid's reimbursement rate is. And I have a feeling they want to go into these communities and not go into, I've never heard the issue being raised in Detroit. And there's places in Detroit where that may be really valuable. Why are we taking a grant away from Detroit Public Schools parents so that Northville parents can have it be slightly more convenient? They only have to drive to the school, not to one of the 50 choices there are within the Northville district.
My dad, who passed away, always told me when I was younger, follow the money. Anything in life, the money. It's a lot is just follow the money. Where do we stand? Does the council, like the school board, have to take a vote with this to go through, or what's the process?
Yep. Yeah, they do. So on twice over the next week, I think it's the 19th and the 21st, they're going to hold a Zoom meeting. That old habits die hard. They should never do that. I told them that.
Why are they doing Zooms?
That's a really good question. And one of the things about the Zoom that I don't like is that questions are curated. So when about, I don't know, 6, 8 years ago, we did a redistricting, just the simplest thing in the school, which elementary school. We hold 5 live forums, ask as many questions as you want, talk about it to the heart's content. Here, 2 Zoom forums where we curate questions. So we're going to have curated questions. And then only after that, they're going to have a live meeting on the 8th and then a vote on the 9th. So
these are official meetings this week. They're official meetings, right? Official meetings.
No, these are
information
sessions. You still message, you still put out the information like it's a meeting, but you just say there's no vote going to be taking on anything. So you just have an informational meeting, but it's still curated. And understand that there is a narrative and a message they want to get out. I checked the link of the FAQs and it was nonstop. You heard this, but this was wrong, and it wasn't wrong. You were twisting the words or changing things, and it's just terrible.
For those who don't know, and I know this is a reporter, curate it means basically at most meetings, even an informational meeting, school board, city council, there's a public session, a public comment session. People come up on a podium and a mic. They have 5 minutes for questions. That's not what this is. Basically, they're taking questions via email or however. They're picking the questions they want, and they're going to answer those.
Correct. And they're going to do them anonymously too, as well. So, which is ridiculous. I mean, it is a much more powerful message when a parent stands up and say, hi, I'm a parent of a middle school kid and I have concerns. I want to know whether consent is required, period, yes or no. And force them to answer the question right then and right there, and then you're allowed, you can do follow-ups. I mean, when we've done this, when I sit on school, we did this a dozen times. Anytime there was a controversial, we are a public school. We report to the public. If the public doesn't want it, the solution isn't hide it from the public or massage the messaging so it makes it look like the public wants it. It's don't do it, because we're a public school.
So if this is the case, they might see a question come in. Oh, we don't like this. We're not going to bring that up. This is very similar to during COVID, Governor Whitmer would hold news conferences virtually, and I asked often to be involved in them. I was denied. Governor Whitmer and her staff, and this is documented by the Free Press and News, they would pre-screen questions and only take certain people. That's not really a good way to get the information out.
Right, exactly. And in your case, you're trying to provide a balanced look. So if you see a yin, you're trying to provide a yang. That's what journalism has done for a long time. We're just parents trying to get questions. And the problem is, if our questions don't match their narrative, as you see, they're trying to craft one, they're not, these two questions are the same. We already answered that. We heard that a lot during COVID.
Yeah, well, that's a not a minor point. That's a big point. They should just be in person. Get out of your house. You probably have a nice, expensive school board meeting room, I'm sure. Go there, answer the damn questions, and just do it. So, the board members probably do we know what the feeling is amongst,
there's a little bit of hesitation amongst, I think, two of them. And interestingly, the two that have the most hesitation are not politically aligned at all. But I think a lot of them are go along to get along. And this has been a focus of our superintendent. But when he was being interviewed for the position, he said, parents, you're not my customer. You're not my customer. The children are.
He didn't say that, did he?
Yeah. And a lot of parents, we all raised an eyebrow, looked around like, what, did he just say that? And yeah, he did. And it's like, please do not advertise that you're going to caught out parents. I don't care where you are. This is Northville, but I don't care where you are. You walk into Detroit, my parents taught for 35 years and 25 years and mostly in low SES locations. You go into those schools and say, parents, you don't get to decide. You better watch it, because the parents, I don't care how much money they have, they take that seriously. And now you're saying, you don't get to do that anymore.
No, and I'm looking right here, according Mackinac Center for Public Policy, which I do some work for. I work for them with social media. They have an online database. The Northville Public School Superintendent makes $329,000 a year. So, he definitely is it. He works. He works for you. He works for every single resident in that area. So, okay, there's so much to wrap around. I'm going to have you on again when it comes to, because I really do not like it when public entities, if they hide behind. Do they do a lot of Zooms like this, or is this rare? Do they do a lot of?
We never did that. We never did that.
Do they now? Do they do Zooms now a lot, even after COVID?
It's probably it's closer to 50-50 than it should be. They kept Zoom meetings all throughout, I think, 2021, which was when we had our hybrid year. We closed down, and then we had a hybrid year 20 to 21. I think they kept that until the mask mandate was removed and by Wayne County, and then they went to more live. They still do blended.
Do they do official meetings in person?
Yeah, they have to be in person. They have to allow an in-person component to it. So, but when you're having these things, these are supposed to be informal, back and forth. It's not narrative crafting. It's listening. It's listening to, and you find things out. When we had some of these issues, we'd have parents come in who are experts in a field, and they'd say, hey, you're doing this wrong. You might want to look at this. And we say, whoa, hey, we got an expert in the field here. Let's change it. And we did, and they were successful. And this is arrogant, and it's they're telling parents they know better. And I'm sorry, I don't care who you are. I don't care where you are, Michigan, elsewhere. You don't know better than the parents, and you don't care more than the parents either.
Yeah, and you should be willing to listen to the parents, and that means coming face to face in a meeting, even if that informational session takes 3 hours.
Absolutely. Ours would take hours. And if it wasn't done, we do another one and do another one and do another one until everyone was heard, everyone's question was asked, and then the board would say, "Hey, I heard this 48 times. We're not doing that."
Uh,
And we used to stay away from it. The other thing that we haven't really talked about, we really ought to,
yeah.
is this what schools should be doing? Really? Are schools now community health centers? Because we can build a community health center wherever we want. Why schools? And it's because they want to get to the children. They want the children to be able to do these things, and my son can't refill his lunch account without my approval, and somehow he can go and get contraceptives. I mean, it's ridiculous.
Yeah, I remember I'm 48 years old. I actually went to Westland John Glenn High School down in Metro Detroit back in the day. And I think we may even have had not a nurse, but someone like if you cut your hand, you can go get a Band-Aid and stuff like that. But I think I remember for medication, I think my mom had to write a note. Like everything had to be right through the office or something. You had to have your parent authorize even an inhaler or something. I think they had to go use it at the office or something.
Right. You had to send a note down and say, Johnny has an inhaler and he needs to use it 2 times a day, and he will come to the office and do that. And it was parent directed. Right. And this is parent directed, and it's transparent what they're trying to do. I get it. I understand what they're trying to do. I just think parents need to be aware of it. And as you made reference to Oxford, you gotta understand, as far as schools and mental health, they're not very good at it. They're not very good at it because it's not deep enough. You can't deal with the issues that are at home. You have to integrate all that stuff.
Well, and yeah, Oxford, and I'm not giving my opinion. Oxford failed. They failed. Their actions led to the death of students. I'm not saying that was in that report. And if anyone ever is able to read that report, I read it, and if I had a child in that, I would just be devastated because oh my God, the chances they could have prevented this. And I know you can't go back, and the shooter is the one who's responsible. But it goes to show that the schools, and that's in a very well-to-do area, that
they rejected a health clinic like that. I think a lot for this reason. That I mean, I read that. We when we were on the school board, you every time there was a school shooting, I don't care where it was, anywhere in the country, Uvalde, the one in Florida, every single one, we would have a meeting immediately thereafter, and we'd say we're allowed to do closed session for security issues, and we'd say, tell me what you understand happened, and tell me that this can't happen here, right? All kinds of different things, and but this particular one, the child was under the guidance of a counselor who was and made a bad decision and didn't ask to check the backpack. And it's terrible. You never want to touch that and go into it. But are they good at mental health? Is this better? Are they going to? And another point that I raised was, for example, I'm a Michigan medicine patient. So are my children. And they said, well, you'll have better access to mental health care. So wait, what? I'm already a patient of yours. Are you saying if I go to a regular doctor's clinic and I get a mental health referral, I'll get it faster through a school clinic? That doesn't make me that as a customer. Come on. Like, really? No, and then to go on further, if the issue is mental health, and it is, okay. First of all, the issue of mental health is this right here. These phones. Throw it in a meat grinder if I could. But if that's the issue, address that issue. Go and get these licensed professionals in the school. School put out an FAQ saying, oh, it's not like hiring counselors because we need professionals. Yeah, I know you need professionals. Hire some professionals. You don't need to offer them birth control and substance abuse treatment if the real issue is mental health. Address it. I get it. But don't.
Someone I think living in your area is joining on my page. You said, what about the issue that will cost the taxpayers and providing access to healthcare does not show up in our district mission statement or vision? I think that person might live in.
Yeah, 100%. They didn't even address it in the district's FAQs. They said it would be a minimal cost and it'll be done to shield the district's general fund. It's not a minimal cost. Grosse Pointe, it started out at $750,000 and ended up at $1 million right before they pulled the plug. It's not a minimal cost. Nothing is a minimal cost when you do it in a school district. So you ask yourself, and particularly in our school, we've been told repeatedly that our buildings are full. So every time there's a school expenditure, ask yourself this question: what's being pushed out? You're doing this. What are you not doing now? What are you not doing now? Because you got to get rid of a room. You got to use the money. You've got to have focus and energy. What are you not doing? I can tell you it's probably something related to actually to your educational mission. And you'll skinny
Yeah.
that down, skinny that down, and skinny that down.
I'm only imagining after well, we're live right now on Locals, and I urge people to sign up because there's no censorship here on this platform. That's why I'm on here. We can discuss things. If I was on Facebook, they might tag me and take me down. But the other side might say that, okay, what about the girl who is pregnant or thinks she's pregnant at home and she's worried her dad's going to beat her? Or that's how you're going to hear that from people. What about the kid who's scared? Or what about what about the kids? And they say, oh, you're just against those kids. You don't want this and that and that. And there's other avenues for that as well. I mean, right? If there is those children, they could go to law enforcement. They could go to a teacher, which are mandatory first reporters. There's
right.
other.
I mean, last time I checked, having sex under a certain age is a crime in this state. So the crime's been committed. The young lady walks in and said, we're this old and we had sex. That's a crime. That's reportable. And then you get the police involved, right? And then the police come in and say, police will go to the house, knock on the dad's door. The police have access to legal resources. If they think the parents are not doing something, that they'll pick up the phone and call Child Protective Services. That's the direction to go. These things have existed for a long time. So absolutely, it's a completely specious argument.
So there might be some good behind this, but whoever wrote the law or the way it's done, they're not looking at the whole aspect of it. And someone just wrote on here, and you may have brought this up, the aim seems to be to allow minors who have no idea, so follow the fad of gender change. I mean, that's a whole issue as well. I know, like in Portland, Oregon, 800% rise in transgender people identify as transgender. And I don't know what the counselor is going to say on that. I mean, it's interesting, and it's very concerning. All I'm saying is, my daughter, I want to know what's going on in her life, and I don't know.
I think that position is frankly very broadly shared. Very broadly. I don't think that cuts right left. I don't think it cuts poor rich. I don't think it cuts, the way various ways issues cut. I think that's very, very broadly shared. And when you start to see, and just like you were talking about with the Whitmer press conferences, right? When you start to see that the narrative is so tightly wound and so tightly protected, you're on the right track.
Yeah. So, okay. So that eventually they're going to have an official meeting and they have to vote on it, I assume, at some point.
Correct. They're going to take a vote on January the 9th of whether or not to apply for the grant. And I have asked people, if you're in the area, please come out and let your voices be heard. Even if you're coming out to support people who are coming up to speak, if I'm in town, I think I will be going out to speak, and I'm going to let them know exactly. Because I'm the parent of two 16-year-olds. This hits right close to home. Do I want these things to happen without my consent? And it's not whether I think that the path that I'm taking is correct. Someone else can second guess me and say, we don't like the path you're taking with respect to contraception. We don't like this path you're taking with respect to substance abuse. We're going to do it our way. And not only that, parent, you don't get to even know about it.
Yeah, that's just not good.
No,
wow.
Not at all.
So I'm going to follow up with you on this. And I actually might come down there for the meeting. I'm up in Saginaw County. Do they live stream their meetings, by the way?
Sometimes they probably will do this one because they like to get a lot of people, and they will absolutely, they've done it before. They will send out to their people, hey, you got to get people to come out because I don't want to make it seem like everyone's against this. They've done it before. And we're asking parents, if you're in the Northville Public School District, which includes Northville, part of Plymouth, and part of Novi, Oakland County, come out. If you don't sit there and say this frightens me, I have to stay on the couch. Because your politicians report to you and they listen to you. And frankly, if they don't listen to you, there's a mechanism to make that change in November of 2024.